Because I always feel like every season that you're in always has a blessing in it. And it's always good to appreciate the things that you've learned and not to always deem every situation as negative, but to always find a positive in everything. And if not just a positive, like something to learn to carry on to the next level of your life. Hey guys, this is Michelle Trades and welcome back to my channel. If you're new here, welcome. My name is Michelle. I'm a pediatric nurse practitioner. As you can see from the title of this video, I will be talking about the things that I miss working in the adult population now that I work as a pediatric nurse practitioner. So for some of you guys that know or some that don't know, I have really spent most of my nursing career in the adult population, but I've always had a thing for pediatrics. Like I've always wanted to work with kids. I haven't really had much clinical experience in pediatrics except for when I worked in the ER for about a year. But otherwise, the most experience I've had with kids is when I used to babysit. But I've always had a thing for kids and I've always wanted to work with kids. So when the opportunity presented itself, I was so happy. I accepted it with open arms. And so far I've been loving working in pediatrics. But sometimes I do think back and I'm like, could I have just stayed in the adult world? Could I have just been an adult NP, maybe worked under a specialty, maybe like a cardiology or endocrinology or GI, like been something like that. And it's interesting, I did run into one of my classmates when I was on the phone trying to consult a specialty clinic in a different hospital. And she's in pediatrics and I'm in pediatrics too. But it's funny, we all started off as family nurse practitioners, but we went into pediatrics. But I also have another classmate of mine that went into the adult world, or at least continued in the adult world as an NP. And I was just thinking to myself, what is it that I do miss? Granted that I don't think I'm switching over in the near future. I think that what they say is true about pediatrics. Like once you go into peds, you don't want to leave it. So with that being said, it was just something I thought about and I wanted to share with you guys my thoughts and what I do miss, because I always feel like every season that you're in always has a blessing in it. And it's always good to appreciate the things that you've learned and the experiences that you've carried on with that, with the things that you've learned, and not to always deem every situation as negative, but to always find a positive in everything. And if not just a positive, like something to learn to carry on to the next level of your life. I think my mom used to say, like, no knowledge is a waste. Like literally wherever you are, like there's always something to learn. What I do miss about the adult world, first of all, I think, and I don't know if it's something that I actually miss per se, but it would have been an easier option for me if I just transitioned from school to becoming an adult NP. I think that would have been an easier transition for obvious reasons of my entire nursing experience has been with adults. So cases that I would have come across wouldn't be unfamiliar to me. Versus me transitioning to pediatrics, it did require a lot of effort, a lot of commitment, and me having to learn new things that I never learned before. Some people don't have the time to relearn new things, so I understand. But I think for me, it was worth it because I wanted to work in pediatrics pretty bad. So I was like, okay, I'm gonna learn everything I need to learn. So yeah, but I do think that if I did, I've thought about like, okay, if I did just go back and just go straight to the adult world, it would have been an easier transition for me and maybe not as much requirement to learn new things other than what I'll be learning on the job. I think another thing that I do miss about the adult world is the fact that, you know, I used to be able to communicate with my patients pretty well. Like interacting with them was much easier. The thing about pediatric population, unless you're like 12 and above, usually it's hard to really have the patients communicate to you what exactly is going on, what they're feeling, and you kind of have to use context clues, whether it's their demeanor, their activity level, their vital signs, their labs, to really figure out what exactly is going on, especially if they're really young, like infants and toddlers and neonates and all that stuff. It's kind of hard to really figure out like what's going on. And I think as much as the babies are cute, the kids are cute, you want to play with them, when it comes to getting actual information, it's easier to just interact with an adult because they can tell you what happened, when it happened, how they feel, And you're able to get much information from them than in the pediatric world. On the other side, though, like even when I worked in the ICU with adults, most of them were intubated and sedated. So on the flip side, I did enjoy not having to interact with patients and just being able to get what I need done without any other factors like emotions and all that stuff. So I did enjoy that. The way that I was trained in the ICU is to go systematically. It was very organized. Not saying that care shouldn't be organized at all, but like it's very organized, and I'm able to know what exactly needs to be done before my patient wakes up and does not have the tube in their mouth anymore. Another thing I do miss about the adult world is like you do have a diversity of people that you can come across and interact with, both with patients, families, coworkers. So I think for me though, where I am currently in life, I don't have children. So my relatability to the parents is limited because I don't have kids of my own currently. In the adult population, I did come across patients that were around my age, did have similarities as far as like maybe our way of living, our culture, whatever it is that we do. So there was that element of having things in common to able to connect with my patients. And I don't see much of that in peds. Currently, again, I think when I do transition to that phase in my life where I do have a family, there will be more opportunities for me to connect more with my patients' families. But I think currently, because we don't have much in common in that regard, I do find a little disconnect sometimes that which was not the case for me working with adults. But it's only temporarily though. But I do feel like in the adult world, I did take care, especially when I worked in the ICU trauma setting. Unfortunately, a lot of trauma cases were people that were in their mid-20s and mid-30s, like people that were a little bit closer to my age. And we did have a lot of commonalities as far as just like they're in school, I was in school, like, you know, like there's things that I can find in common with them versus, you know, a population where one, I'm not a child, but two, I'm also not a parent currently. So all I can focus on is just taking care of my patients. But as far as like connecting with families, there's a little bit of gap there. One thing I do miss though about the adult population was that everything was like normal size. I feel like in pediatrics, everything is such a small size. Everything is so nuanced and specific. And I mean, some of you guys might know, but in pediatrics, the dosages of medications are weight-based. There's a lot of like measurements and calculations, and just the pediatric world is so different. And I feel like adults, there's like just one standard, that one size fits all kind of thing. So I think in peds, like you do have to make so much consideration before making decisions as far as like the medications you're using, the care that you're using for each patient, and just a lot of considerations. Whereas in the adult population is just one standard size and one standard mode of measurement that just works for all adult populations. So it's not a lot of things that you have to tailor and switch up and adjust for the patient like you would in peds. But overall though, I really like working in peds, but I do think about it, I'm just like, I wouldn't have had to come across this situation if I worked in adults. Or I'm like, you know, this is a little different than adults and what I'm used to. But I feel like once I put in more years as in my role in pediatrics, I think it would give me a different perspective. Right now, I do have more years working with adults than I do in peds. So a lot of my opinions might be biased. A lot of my opinions might be skewed because I have more experience in one world than I do the other. And it will be interesting to see, like, as years go by, how I will feel now that I've transitioned to pediatrics, and if I will still have the same sentiments and opinions and still hold the same statements that I'm sharing with you guys today. But so far, so good. If you guys have any questions, feel free to comment below your questions and thoughts and commentaries. Feel free to interact on this video. I will be sure to respond and just keep conversations going. If you like this video, please give it a thumbs up. If you don't mind, can you share it to your friends and family? Like, share it and let people know what's going on. And, you know, people can drop their commentaries as well, suggestions of what kind of videos you want to see me post. And I'll be happy to respond and check it out. But otherwise, thank you guys for watching, and I hope to see you guys at the next video. Bye.